Well, I got an interesting question the other day on a comment saying, should everyone get therapy? I think I was talking about how good therapy is as a treatment for a lot of psychiatric illnesses. But when that question was asked, it really got me thinking a little bit. And like all things in psychiatry, the answer is complicated. So if you're new here, a warm welcome. My name's Syl, I'm a junior doctor from Australia. I'm on a psychiatry training program and I make these videos in my personal capacity in my free time. None of this is medical advice. None of this is the position of a medical college or a workplace. These are just my personal views. The same goes for all my videos, and if you have been here before, you might realize that I've got a bit of a different background. That is because it is boiling hot in the garage where I usually film, and so I've used a little spare corner in my house. But let me know what you guys think of this filming setup. Anyway, back to the question, should everyone get therapy? Well, we've got to explore our definitions. Like all questions, you need to understand what are the definitions of the terms, being used. And I've heard some psychiatrists even talk about therapy as if everything is therapy. Every interaction you have is therapeutic in a way. Look, if you take that approach, then yes, everyone should get therapy, and that makes this video very simple because social interaction is, for the majority of people, a very important part of good health. But if you take a more nuanced view of therapy and we kind of understand exactly what we mean by the term, then it can be a bit more interesting to think about. So in this video, let's look at what is therapy, who benefits most from therapy, and what are the barriers to therapy and the side effects of therapy, because yes, therapy comes with side effects. So in the context of this question, should everyone get therapy, I think it's important to appreciate that therapy, the way I see it, exists on a spectrum. Now, most people know a lot of acronyms of different kind of structured approaches to therapy, like cognitive behavioral therapy, CBT, acceptance commitment therapy, ACT, interpersonal and social rhythm therapy, IPSRT. Apparently, if you want to invent a new therapy, it has to come in an acronym, and the list does go on. I think instead of talking about each type of therapy and who benefits from what, it's probably more helpful to think of the therapy as a spectrum, okay? And this is useful for everyone to think about. And the spectrum is ranging from one end, that is supportive therapy, to another end, that is expressive therapy. And there are very important differences that tell you where the therapy lies on this spectrum. Supportive therapy is, I guess you could argue, the safest kind of therapy. It is about using someone's current skills, strengths, coping mechanisms, and reinforcing, empowering, and supporting them to use the skills they've got. Okay? It is not about exploring unconscious defense mechanisms and hidden drives in the decisions we make and that kind of thing. So that's the supportive end. And counseling and supportive psychotherapy and motivational interviewing might be all on that end of the spectrum. Way on the other end of the spectrum is the expressive therapies. This is things like psychodynamic psychotherapy, things like psychoanalysis. So, psychodynamic psychotherapy is about having, usually it's multiple sessions a week, but these days it's mostly one session a week. It can be more. It's about doing it usually a bit longer term than like CBT or ACT, but there are some shorter term psychodynamic therapies out there. And in doing a longer term therapy with a therapist, you find that there are things that come out in the relationship between you and the therapist that kind of show you your unconscious defense mechanisms and attachment behaviors and styles and ways of attaching. Some helpful, some less helpful. it can be very painful, it can be very exposing. It often involves reflections through childhood and early experiences in life. That's psychodynamic psychotherapy. The most expressive psychotherapy is psychoanalysis. And in this kind of therapy, you don't even look at the therapist for most of the session. You're in a couch facing away and you're just having kind of a stream of consciousness come out, with a therapist that sits behind you and makes interpretations at times. So that's extremely unsupported, right? Like, you're not getting any kind of you're getting minimal interpersonal support in that kind of therapy. And then in the middle is where I think a lot of these structured therapies, sit. So things like CBT, where you have 10 sessions, you look at the ways you manage stress, and you try and develop strategies to improve the ways that you manage stress. But you're not doing it for so often. CBT is, 10 to 20 sessions. And often the attachment dynamics between you and the psychologist aren't really activated, because it's relatively brief. And same with ACT. I think schema therapy is another type of therapy which looks at, ways of thinking, and that is a little bit more expressive. But these all kind of sit in the middle between the supportive and the psychodynamic psychoanalysis things. So anyway, this spectrum has to be considered when you're asking any question about, any question relating to should everybody get therapy. Absolutely not if we're talking about the more expressive therapies. It is not helpful for everyone to do expressive psychodynamic psychotherapy at all times in their life. Not everyone should have that. Usually one needs to have a bit of distress tolerance, which is something that you can learn in CBT or dialectical behavioral therapy, DBT, because it can be distressing, some of the stuff that gets revealed. You certainly wouldn't do something like an explorative psychotherapy right after a traumatic incident, right? You need to, all therapies really, but right after a trauma, the most important thing is stability and security and establishing a safe interpersonal relationship and security. So yeah, no, I wouldn't say that everyone should get psychodynamic therapy at all times in their life. And when we're considering the benefits of therapy, which are, significant, and people with treatment-resistant depressions can often get significant improvements if they, haven't responded to medications, and then they do therapies, and they get sometimes quite a positive response. It just takes longer and is harder and is more expensive, but it usually has more sustained benefits as well. So then if we go to the other spectrum, the supportive psychotherapy, should everyone get supportive psychotherapy? Well, also no. Like, supportive psychotherapy is great if you need it. It's wonderful if you need it. But if you're functioning well and you don't have particular issues that would benefit from a supportive psychotherapy approach, your defenses are adaptive, you're coping well, you're managing life, then it's probably not worth the cost of it. Also no. So I think I'm discovering the answer to this question is that no, not everyone should get therapy at all points in their life. So when should people get therapy? That's a good question. I think everyone who works in mental health or is involved in doing therapy should, at least at one point of their training, have their own therapy. You can't expect to be a therapist without getting therapy, because there is a very important experience that happens when you are the patient. So I would say that if you're if you're doing mental health nursing or psychiatry training like me, or any other kind of mental health counseling thing, you yourself should have the experience of going through therapy and seeing how exposing and vulnerable and painful, but also helpful it is. Full disclosure, I haven't done formal therapy, so I'm planning to do it after I finish my exams, because one of the side effects of therapy is that it can be destabilizing, and I currently am coping relatively well with life and stresses, and I don't want to have any destabilizing things before an exam. and my priority in life goal and stuff is to get through these exams in September. So, that's a personal decision for me. But that goes to answer this question: should everyone get therapy? Not right now. It's probably the not always at all times. It's probably the right answer. I think the other group of people that benefit from therapy are people who are functioning well, but having an area of their life that is causing distress. So if that's work, if that's relationships, and it's really affecting your ability to be content with life, then people who are, able to hold down jobs and have healthy relationships, but still are feeling not content or distressed by one part of their life, they benefit from therapy. And if they're higher functioning, that means they generally have more adaptive ways of managing stress, and so they can have therapies on the more expressive end of things. And I'm a big advocate for psychodynamic therapy and people who have healthy ways of managing stress. So that would be a good group of people for that. Another group of people who benefit from psychotherapy are people with kind of the depressive, anxiety, obsessive compulsive disorders. And that group responds well to the middle range of therapies, the CBT, ACT, schema-based therapy. Those are all indicated for disorders in that range. And so what about the supportive therapies? We've kind of talked about the middle and the more expressive, but I think supportive therapies are really important, certainly for people who have recently undergone, a very unsafe experience or a traumatic experience. For people who have a psychosis, with a more severe schizophrenia or psychosis-like illness, supportive therapy is a really good idea. And now there's even CBT for psychosis, which is about learning on developing strategies on picking up early warning signs and having healthier ways of managing the symptoms when they happen. Learning how to tolerate the symptoms is really important. So it's kind of in that supportive to middle range. And things like motivational interviewing and supportive therapy are really important for people with substance use disorders as well. Maybe not the best way of managing stress, but it's not exactly a choice. So having those kind of supportive psychotherapies, looking at other strengths that the person has to manage stress instead of using substances, and helping the person achieve the goals they want to achieve is really helpful. So all this to say that different therapies are important for different people, but at different points of their illness or points of their life might mean that the therapy is or is not appropriate. And the other group of people that would benefit from a supportive kind of style of therapy, I know I talked a bit about trauma, but also in role transition, which is another term, and adjustment processes. So this is when someone, so say I lost my job, that's a big, or say I got deregistered or something like that happened to me. That would be a massive hit to my identity. I see myself as a doctor. I see it as a vocation. I enjoy being a doctor. If I was to lose that part of my identity, that would be a massive injury to how I see myself and how I value myself. That would be a massive role transition. I would be changing my role, and I would probably regress and be in distress and so I would benefit from having someone who could almost be like a guide or a constant source of support in that transition and period of loss. So that's another period where supportive psychotherapy is really important. So another thing to say is that therapy is not all good. There are barriers to accessing it. It is expensive. There is evidence to suggest that the therapist you work with, the individual, is more strongly associated with a positive outcome than the type of therapy you do, which highlights that important in attachment styles and attachment process, I should say. Often therapy involves inconvenience, like taking time off work, going there and play in person, that kind of thing, although now it's more telehealth. So there's barriers to getting it. And importantly, there are side effects to doing it, right? Often people might feel worse before they feel better as their views of themselves get confronted and changed. Although therapists are generally very gentle and sensitive, they might expose a part of you were kind of avoiding and you didn't realize that actually some of the problems in your life were because you did a thing a certain way, and before that you thought it wasn't your fault. I know that's happened with me. So these kind of things can be painful, and that can increase the stress before improvements are seen. You can also foster dependence. If the therapist becomes the only person that can help you, and you have a dependent kind of attachment dynamic, you might find yourself in a dependent situation, which sometimes is just how it goes. But the goal of therapy is really to get you to live a life that's worth living for you. So that can be a tricky thing to disentangle from afterwards. And so it is helpful to have a structured agreement to how you approach therapy, have regular check-ins to see if things are working or not working. And I guess you just need to talk to your therapist about that. So that's my long-winded answer to that question around should everyone get therapy. So to close, no, not everyone should get therapy, certainly not at all times. I think throughout the course of a single life, though, everyone will probably benefit from some type of therapy at one point in their life. And I'm personally looking forward to doing some expressive kind of work, I hope, towards the end of the year. And encourage anyone who works in this field or wants to work in this field to do it as well. All right, let's close the video there. If you've had your own personal experiences with therapy not working for you or having negative side effects from therapy, I know it's not pleasant to talk about, but if you're open to it, please consider sharing your story, because it is important for people to learn and read about that therapies can come with side effects, and that can be content to consider when making these decisions. If you like this kind of content, these reflections and these discussions in mental health, please consider liking this video and subscribing to my channel. If you have any other questions, please leave them in the comments below. I do try to read all comments, and I do try to make a video a week, although I realize I've been a bit lacking in that recently. But other than that, I wish you all just a beautiful day full of love, and I'll see you all in the next video. Okay, bye for now.